Hi everyone. Today let us start a new session, Learn with Fun. Let us discuss pharmacology concepts in an interesting and easy way by solving few of the puzzles. While we are going to deal with pharmacology, we can come across with so many types of drugs which are having the different types of names. Few of the drugs are having the similar prefix and few of the drugs are having similar suffix. For instance, we have one of the drug metoclopramide, which may be somewhat similar to the metronidazole and metoprolol. All these are somewhat confusing. Similarly, if you have the drugs like clozapine, clomiphene and clonazepam, all these drugs are starting with the prefix clo, so they are somewhat confusing. So it is very difficult to remember the drugs and their categories, how they are acting just by seeing the name of the drug. But fortunately, we have drug suffixes which can be used to identify few of the drugs and their categories. For instance, a suffix azole indicates they are antifungals. So drugs like clotrimazole, fluconazole, ketoconazole, all these are the azole antifungals. Similarly, a suffix dipine indicates these drugs are dihydropyridines. Drugs like nifedipine, felodipine, amlodipine, isradipine, all these are dihydropyridines. Another suffix is the olol, which is well known. The drugs like beta blockers are having the suffix olol. So by just seeing few of the suffixes, we can identify the drugs and their categories. So today in this video, we are going to discuss the pharmacology concepts in the form of few of the puzzles, where you can solve the puzzles with some logic, which adds fun to the learning. And after watching this video, you can determine whether it is easy, medium or difficult, and post your valuable comments in the comment section so that we can discuss the concept in more detailed way. So now let us start our pharmacology session, Learn with Fun. So let us start with the first one. Find the drug name with following clues. Here we have to fill the name of the drug within the following blocks with using following clues. The first clue is it is a beta blocker. Second one, it is a selective blocker. Third one, it is used in heart failure at a starting dose of 12.5 mg. Here you have to find the drug name with the following clues. It is a beta blocker and it is a selective blocker which is used in the heart failure at a starting dose of 12.5 mg. Now you can think about this question. You can have the 5 seconds time, and after the 5 seconds you can pause this video and again you can think about the right answer. Now let us see how we can solve this puzzle and we can learn the new concepts about beta blockers. Now if we go with the first statement, it is a beta blocker. Since beta blockers are having the suffix olol, we can fill the suffix with letters OL. All the beta blockers are having the suffix olol except few of the beta blockers with additional category of activity. For instance, sotalol is a potassium channel blocker with beta blocker activity. That's why it is having the suffix ALOL. Instead of OLOL, it is having the ALOL because it is not a pure beta blocker. Similarly, carvedilol is a alpha and beta blocker which is having the suffix ILOL. Labetalol is a another alpha and beta blocker which is again having the suffix ALOL. Except these three drugs, which are not the pure beta blockers, all other beta blockers are having the same suffix olol, OLOL. So this is the first concept by which we can easily identify whether a beta blocker is a pure beta blocker or it is a beta blocker with additional class of activity. Three drugs, sotalol, carvedilol and labetalol, are not the pure beta blockers which are having the different suffix. Now if we go to the second statement, it is a selective blocker. Now among the beta blockers, we have two types of categories: non-selective beta blockers and selective beta blockers. How we can identify the selective beta blockers? So we can have a simple trick to remember the selective beta blockers. Then we can easily differentiate them with non-selective beta blockers. Let us list out the selective beta blockers with simple mnemonic A2B2 men. So here A2 indicates atenolol and acebutolol. B2 indicates betaxolol and bisoprolol. These are the A2 and B2. Then men indicates metoprolol, esmolol and nebivolol. These are the 7 selective beta blockers which can be remembered with the simple mnemonic A2B2 men. Among these, nebivolol is a selective beta blocker with additional activity. It can increase the release of nitric oxide which produce the vasodilation. But even it is having the additional activity, still it is having the suffix olol because it is not blocking the receptors or ion channels. Simply it is releasing the nitric oxide just like the nitrovasodilators. So nebivolol is again a pure selective beta blocker with additional vasodilatory actions. Now among these 7 selective beta blockers, we have to identify the drug which matches to the statements given here. In order to spot the right answer, let us see the next clue given in this puzzle. Now let us go to the third clue. It is used in heart failure at a starting dose of 12.5 mg. Normally beta blockers are having the negative inotropic effect. That means they decrease the force of contraction. Therefore they reduce the cardiac output. That's why beta blockers are not suggested in the treatment of heart failure. But still few of the beta blockers can be used in the heart failure because they reduce the cardiac activity. Thereby they can reduce the cardiac work and improve the symptoms of heart failure. So now let us list out what are the beta blockers that are indicated in the treatment of heart failure and they are approved by FDA. Particularly selective beta blockers are used in the treatment of congestive heart failure. One of the drug is the metoprolol, another one is bisoprolol, and third one is the carvedilol. The first 2 drugs, metoprolol and bisoprolol, are selective beta blockers, already we have discussed earlier. Then what about the carvedilol? You can clearly observe that in the suffix of carvedilol, you cannot observe olol. It is having the suffix ilol, which indicates that it is not a pure beta blocker. Carvedilol is a beta blocker with alpha blocker activity. Otherwise, it is also called as alpha and beta blocker. Now here we have to identify a selective beta blocker that is used in the heart failure with a starting dose of 12.5 mg. So carvedilol is not the right option here since it is not a selective beta blocker. Now we have 2 drugs, metoprolol and bisoprolol. Both are having the same number of letters. So what is the right answer for this puzzle? Here bisoprolol is a selective beta blocker which is used in the heart failure at a starting dose of 1.25 mg. So it is not the right answer for this puzzle. Instead, metoprolol is the one of the selective beta blocker which is indicated for the treatment of heart failure at a starting dose of 12.5 mg. So the correct answer for this question is the metoprolol. Metoprolol is started at a low dose of 12.5 mg such that the dose is slowly increased up to 200 mg. On the other hand, bisoprolol is started at a low dose of 1.25 mg and the dose is slowly escalated such that it is in between 5 to 10 mg. Now let us go with another puzzle. Find the drug name with following clues. The drug starts with the letters AMI, and what are the clues are? It affects potassium transport. It may cause pulmonary fibrosis. Again, you can have a time to think about the right answer. Otherwise, you can pause the video and you can get the right answer. Now let's solve this puzzle. First of all, let us identify the drugs which are starting with the letters AMI. So if we carefully recollect, we can identify the 3 types of drugs. First one is amitriptyline, second one is amiloride, and third one is amiodarone. Among these, we have to select one of the drug according to the statements given here. So what is the first statement? It affects the potassium transport. Which type of drug affects the potassium transport? So if we see the list, the first one is amitriptyline, which is a tricyclic antidepressant. Second one is amiloride, which is a potassium sparing diuretic. Third one is the amiodarone. Amiodarone is the potassium channel blocker which acts as antiarrhythmic agent. So among these 3 drugs, amitriptyline is not affecting the potassium channels directly. So it is not the right option here. But other 2 drugs, amiloride and amiodarone, can affect the potassium transport. Amiloride is going to reduce the potassium secretion and amiodarone is going to block the potassium transport out of the cardiac membrane. Now, in order to identify the right answer, let us go for the next statement. So the next statement is that it may cause pulmonary fibrosis. So among these two drugs, amiodarone and amiloride, which produce pulmonary fibrosis? The right answer is the amiodarone, which is a potassium channel blocker and class 3 antiarrhythmic agent. This amiodarone can produce pulmonary fibrosis at toxic dose, so it should be carefully used. And this drug can also produce thyroid abnormalities. It can produce either hyperthyroidism or hypothyroidism. And it can also produce some corneal deposits, gray skin discoloration. All these are the side effects of amiodarone, which is a class 3 antiarrhythmic agent. Since this drug acts as a potassium channel blocker, this drug can increase the QT interval within the ECG, which may precipitate torsades de pointes. So amiodarone is a proarrhythmic agent which can increase the induction of torsades de pointes, so it should be carefully used in the patients to treat cardiac arrhythmias. Now if we summarize amiloride and amiodarone, amiloride is a potassium sparing diuretic. It blocks the renal tubular sodium channels, thereby it inhibits the reabsorption of sodium. So when the sodium is excreted, potassium is more retained within the body. That's why amiloride can be used in the treatment of hypertension as well as heart failure, and particularly amiloride can be combined with other drugs which produce hypokalemia. On the other hand, amiodarone is a potassium channel blocker. It is classified as class 3 antiarrhythmic agent. Amiodarone can produce many of the side effects. Amiodarone can produce thyroid abnormalities because this drug is having the iodine moiety in its structure. So this drug can produce either hypo or hyperthyroidism. It can also produce corneal deposits, pulmonary fibrosis at very toxic doses, and it can also produce some gray to blue discoloration of the skin. All these are because of any presence of iodine moiety within its structure. Similarly, if we summarize beta blockers, there are two types: non-selective beta blockers and selective beta blockers. The selective beta blockers can be remembered with simple mnemonic A2, B2, MEN. A2 is the etanolol and acebutolol. B2 is the beta-oxazolol and bisoprolol. MEN is the metoprolol, esmolol and nebivolol. These are the selective beta blockers, and other beta blockers are non-selective. So we can list out propranolol, timolol, nadolol, pindolol, penbutolol and cartiolol. All these are non-selective beta blockers. Few of the beta blockers like labetalol and carvedilol, they are alpha and beta blockers. And sotalol is a potassium channel blocker with beta blocker activity. If we see the beta blockers used for congestive heart failure, we have three types of beta blockers. First one is metoprolol, second one is bisoprolol, and third one is carvedilol. They differ by their starting dose and final dose. Metoprolol is started at a dose of 12.5 mg and the final dose is achieved around 200 mg given once daily. On the other hand, bisoprolol is started at very low dose. It can be started at 1.25 mg where the final dose is ranging from 5 to 10 mg. Finally, carvedilol can be started at 3.125 mg and the final dose is variable from 25 to 50 mg. So that's all about the pharmacology concepts. That's for today. I think this video is helpful to you. Post your comments, doubts and any ideas in the comment section such that we can discuss in more detailed way. If you really like this video, please share this video with your friends to reach more number of people and click the like button to support our work. In our next video, we will come with another interesting concepts in the pharmacology. Until then, have a nice time. Take care. Goodbye.